move to the next speaker, if that's okay with Colin. Colin, are you okay to be our first speaker? And Colin's joining us from the Alzheimer's Society, and he's going to be doing a session on improving diagnoses and health outcomes for people living with dementia. Thank you, Colin.
Thanks, Steve. You can have what would be a well-deserved break now, I think.
Yeah,
some
thanks.
energy that first few minutes. Hi, everyone. I'm Colin Capper. I'm the Associate Director of Evidence and Participation at the Alzheimer's Society. So I'm based in London, but with us today are some of my local colleagues in Gloucestershire who I've been chatting to over the last few weeks in preparing for today. I'm going to try to share my slides, and I'm grateful for Paula, who's providing backup if we have any technical issues with this. Let me see if I can make this work. That looks good to me. Steve, do you mind just saying something?
It's there, Colin. It's there.
Lovely. Thank you very much. We're all getting used to having to check this. So yes, my a little bit of time with you today is focused on improving diagnosis and outcomes for people with dementia, and it was interesting to hear the reference to this session originally being planned for 2 years ago, when perhaps the discussion might have been a little bit different, and the focus of a conversation about improving diagnosis was probably going to be about addressing variation and improvement, as opposed to making our way back towards the pre-pandemic target of 2/3 of people with dementia having a diagnosis. But a lot has happened in the last couple of years. What I'm hoping to do, and I hope that my now opening session will just set a little bit of context for some of the rest of the conversation we're going to have, and some of the speakers. I'm going to talk a little bit about where we are nationally and locally in terms of diagnosis and post-diagnostic support, and reflect a little bit on the scale of the challenge nationally and locally. People in the audience will appreciate how complex dementia is at an individual level, at a societal level. Dementia and dementia care is about healthcare and social care. It's about medical care, psychological care, and social support. And it really needs a system response to getting these things right for people with dementia. That said, what I'm hoping I can share today is some quite practical recommendations that have emerged from the Alzheimer's Society's research and evidence gathering with people affected by dementia and people working in health and social care in dementia over the last couple of years. And I'll reference a few reports in that people may want to go and take a look at, and pull out some of the recommendations that I hope will be of interest to you. I also wanted to start by saying that in preparing for today and working with my local colleagues, you know, we've looked at national and local diagnosis numbers. We've looked at numbers around things like the number of annual reviews of care and support that people with dementia receive. And whilst there's a lot to do, and there's a lot to do everywhere, whilst there's a lot to do in Gloucestershire, there's a lot to be very proud of as well. And I know there are a number of local initiatives that people will be talking more about later, that are making a really valuable contribution. Your commitment to developing a new dementia strategy and involving people with dementia in that, in shaping that, is wonderful and is really great to hear about. So whilst there's room for improvement, and whilst there's plenty of that, I wanted to make sure that was the tone of at least my thoughts in being shared with you today. So well done for the hard work so far. Lots of hard work to do from here on. Hopefully my slides will move. There we go. A quick intro on national diagnosis rates. This will be familiar to many of you, but the blue line on the graph shows diagnosis rates falling from just at the February of 2020, when the pandemic really started to to hit through to the beginning of this year, 2022. This graph ends in 2022 with what you can see is about a 4% fall or a 5% fall in diagnosis rates in the years since the pandemic, indeed in the time between this conference being planned to be delivered and now. That figure has pretty much stagnated since the beginning of January this year, and the national rate remains at 62%. Again, a little bit of context. There are currently 900,000 people that we predict, looking at prevalence data, have dementia in the UK. If we then ask ourselves, given we have a 62% diagnosis rate, how many of those people are undiagnosed? That's somewhere in the region of 442,000. And I share that number because if we think nationally about there being 442,000 people in our communities and in our care homes who are likely to be experiencing dementia but haven't got a diagnosis, and perhaps their families don't have the support in place that may be a real lifeline for them, that's a pretty dreadful thought. As I said, this is a large and complex issue. Money alone will not solve the challenge of increasing the number of diagnoses that we're able to conduct nationally or locally. There are challenges around recruiting skilled people in the right roles to be able to increase the number of diagnoses that we deliver, and certainly the amount of post-diagnostic support we're able to deliver. But certainly the amounts committed at a national level recently, something in the region of £17 million to address challenges around diagnosis are insufficient. There's a little bit of background noise. If somebody is not on mute, I'd be grateful. I'm sure others would be. We estimate that in order to make up the number of diagnoses back to the national target of 2/3, which right now is the Alzheimer's Society's priority, that we get back towards that level. Something like £70 million will need to be invested in our systems and our services to get to that point, which is a very significant amount. The 4-year reference is our calculation of how long it would take without additional resource, and if nobody else enters the system to get a diagnosis, it would take to get back to that diagnosis rate. So if we only tried to catch up, it would take us until 2026 to do that with no additional resource, which too is a pretty dreadful thought. So that's the national picture when it comes to diagnosis. In Gloucestershire, again, some of these figures will be familiar to you. The current diagnosis rate is just above the national average at 62.3%. And again, I said at the outset that there are things to celebrate here and things to recognise and focus on and want to improve. And I'd certainly say that there are many parts of the country where diagnosis rates have fallen more significantly than in Gloucestershire, and it may well be through your local innovations, through your efforts to take diagnosis, if you like, to avoid diagnosis falling further, including the co-diagnosis work in the Forest of Dean may well be contributing to you maintaining or at least not allowing diagnosis rates to fall further than they have. It's always, I think, interesting, if not useful, to have a comparison, but some of your neighbours are struggling more with this. There's been a greater fall in the numbers of diagnoses across Worcestershire, where the diagnosis rate is currently around 52%, and you pre-pandemic were in a similar position. However, numbers of people with dementia are continuing to increase, and they are forecast to increase to something in the region of 14,000 people by 2030. And if diagnosis rates don't improve significantly for those people, we may find that by 2030 there are something in the region of 5,000 people in Gloucestershire who have a diagnosis of dementia. Who have a dementia but don't have it diagnosed. Gary will talk later, I think, about how important it is to get a diagnosis, and I'm sure many of us will appreciate that it helps to unlock that planning and support for the future and treatment for many people. So that's the picture currently around diagnosis in Gloucestershire. I just want to take a minute to flag particularly one of these reports. The report on the left is one of a series of 3 reports on diagnosis in dementia that the Alzheimer's Society have published. This is focused on regional variation. There's also a report that focuses on people from ethnic minority groups and diagnosis within that community, and rurality is a third theme, available on the Alzheimer's Society's website and available via me or Ben or Nicola, who are with us today, if you just want to drop us a line in the chat or email if you have difficulty accessing them. The regional variation reports highlights some of those points around regional variation and makes a number of recommendations to drive improvement, pulling out some examples of good practice across the country. I also want to flag the report on the left to cope alone. No, sorry, it's on the right. Left to cope alone, which is again in a series of reports. This one focused on post-diagnostic support and includes a significant amount of evidence we've gathered, both from research but also from people working in clinically and in care for people with dementia, and thousands of people with dementia who contributed insights to help shape that, and that makes some recommendations around post-diagnostic support. So some of what I'm about to share comes from the regional variation on diagnosis reports. I've tried to focus, as I say, on some practical actions that might be useful to you and could be implemented locally. First thing I wanted to say, though, was how we can sometimes be challenged and sometimes asked at the Alzheimer's Society about whether people with dementia really want a diagnosis. The top line here is from a recent survey we conducted ahead of Dementia Action Week in the spring of this year, where of 1,000 people with dementia or their families, 9 in 10 told us that they felt it was better to get a diagnosis, largely because that was about knowing and understanding what was happening to them, but also then being able to take the steps to be better informed and put support in place. And I'll just pause for 30 seconds to allow people to read, if they can, those couple of quotes from a person living with dementia, from people living with dementia are affected by dementia, about the value of diagnosis. So some practical suggestions. As I've said, there is some great innovation going on locally, and I'm really looking forward to learning more about that, and over time learning more about the outcomes and the evaluation and that come from those initiatives. But I picked out a few ideas from our reports and some learning from those that may be of interest to our audience today. The first is the Dementia Quality Toolkit. And the Dementia Quality Toolkit allows primary care to effectively search their primary care registers using a series of filters to identify people who may have dementia but may not be diagnosed with a dementia. So the types of filters that have been used are things like filtering for people who might have been diagnosed with delirium during a hospital stay. You can filter using the codes that are attached to patients to help identify people who've been coded with things that might indicate dementia. You could filter by medication to see what types of medication people might be on and what they're treating and how that might be associated with dementia. And one commissioner that we talked to about the use of the dementia toolkit told us that he felt it contributed to being able to increase diagnosis rates by something near 25%. Well, by 25%, not near 25%, in the local in their locality. And again, there's a short case study in our regional variation report if people want to look into that further. But that's a toolkit that is available with guidance currently. The other, I think, a practical step is thinking about information sharing. Can be a significant challenge for lots of reasons, but one very practical recommendation we've pulled out is thinking about inappropriate or inadequate referrals. And I think the starting point for that is considering whether either or both of those things are issues with referral and diagnosis in Gloucestershire. One suggested initiative is whether there might be a piece of work to be done to help educate those referring into the memory clinic, working with primary care perhaps to understand what eligibility criteria are. Is that well understood and established across Gloucestershire, and indeed why it's important for there to be adequate information in a referral. Often gaps in key information on a referral mean that it's difficult to take those referrals forward. In the next slide, I've got a useful tool, I hope, to share with you to help drive up appropriate referrals from primary care into secondary care services. I also wanted to point out that over the last 4 years, the Alzheimer's Society's research team have funded and been working closely with the University of Newcastle, which is our centre of excellence on primary care-led post-diagnostic support. If that's new to people, then that work in Newcastle, well, it's led in Newcastle by Professor Dame Louise Robinson, who has been working with teams across Newcastle and in London to design, informed by many of the good practice examples across the country at the moment, and the
2 minutes, please, Colin.
The evidence. Thank you. That's really helpful. I'll speed up. Has designed and is now evaluating a primary care-led model of dementia care, which I think there'll be lots of learning for many of us to take. I will skip a little faster. This is a symptom checklist, which is again available on the Alzheimer's Society's website. We promoted this during Dementia Action Week this year. This allows people who are concerned about their memory or concerned about somebody else's memory to prepare for a visit to the GP to have this discussion, having thought about the symptoms they're experiencing, and take this with them, and in turn hopefully help GPs make more informed assessments of the symptoms that people are experiencing, and then be able to improve appropriate referral rates. Endorsed by the RCGP and live at the moment for people to use. That could be useful for you across Gloucestershire. This is the picture of post-diagnostic support. Currently we surveyed about 2,000 people receiving post-diagnostic support last year. We asked about the last 12 months of care, and 61% of people said that they had not received enough support from local services over the last 12 months. Again, the picture is a little bit better when we look at data across the southwest of England, where, for instance, that 16% figure where people said yes is higher by a couple of percent across the southwest. Locally, something like 43% of people have had an annual review in the last 12 months of their care. That is much better than the 25% that was reported nationally from our survey, but again leaves a significant number of people without an annual review and without perhaps the kinds of holistic care and support in place that's needed. And the last figure here shows why that's so important, that I think this data's from July this year, but across Gloucestershire, something in the region of 30% of people had an emergency admission in the last 12 months, 30% of people with dementia. I tried to do the maths on this yesterday, and it came out at around 1,500 people being admitted who have dementia in some way. And clearly that makes a very significant demand on services, but also is pretty dreadful for the people with dementia who are admitted, or the carers who are admitted. I'm conscious of time, so I'll jump through these quotes about what lack of support for after diagnosis means, but people are exposed. We've done work on what people want from post-diagnostic support. This could be helpful in assessing the services that are available locally and the types of post-diagnostic support the Alzheimer's certainly provides, but education and consistency were important to the many people who shared insights to us with that. And to finish, lots of really good things happening locally, lots to learn from, a fabulous commitment, I think, within Gloucestershire to driving up in improvement. Just wanted to call out that the stepped model of care in Stroud and Berkeley Vale, where people are able to access a dementia support worker as a care coordinator, and if their needs require it, they can be escalated, if you like, or stepped up to a dementia nurse. And I think there's a lot of very good things in that we can learn from, and hopefully demonstrate improved outcomes for people with dementia. To finish, dementia is complex. It's a real challenge for the system, and I don't think there's a better candidate for us thinking about how integrated care can really improve outcomes for people with dementia, and that starts with diagnosis. So I will stop there. There are a couple of email addresses there for people in our local teams. I am colin.capper@alzheimers.org. Please feel free to ask questions now, or post them, or email us directly, and we'll do our best to answer them. But yes, lots of good promise to work with.
Thank you so much, Colin. That was excellent. Thank you so much. Really interesting talk, and I think you started off by talking about the need for a system response for people living with dementia and for increasing the diagnosis rate, and that's really true. And as you've highlighted throughout your session, we're doing quite a bit in Gloucestershire already